textbooks will put the lymphatic system in with the cardiovascular system. And still other textbooks will put the lymphatic system in with the immune system. With the what? The immune system. And as we're going to see, it's a component of both. It's a component of the immune system and the cardiovascular system. Now, there are a couple of obvious reasons to learn the components of the lymphatic system. The lymph system drains the tissue spaces. The lymph system drains the tissue spaces. So anything that is abnormal, rotten, infected, pathogenic, invasive, tends to be picked up by the lymphatic system. So, if you are trying to figure out where an infection is, you would look at what the reaction of the lymphatic system is in that area. If you are trying to figure out how far cancer has progressed, you would look at what you see or what you find in the lymphatic system. And part of the physical assessment that you're going to be taught is to feel for lymph nodes, and I can see some of you doing it. Another part of assessment that you are going to be taught is to look at edema. And swollen lymph nodes, or lymphadenopathy, and tissue swelling, or edema, are two of the biggest tip-offs of what's going on with the lymphatic system. Now, it's important. Let me tell you a story. Back when my brother, before my brother got married, he's a critical care nurse or was a critical care nurse at Shands, and so therefore he tended to think the worst out of any particular medical problem, especially if it involves somebody that he cared about. So his girlfriend developed a huge swollen lymph node in the inguinal area. So he calls me and he's like, what's the problem here? And the very first thing I said was, does she have any injury or cut, scrape, deal in her legs? Now, why would I ask that?
Infection.
Because a swollen lymph node, the first thing you think of is infection. And these lymph nodes right here drain what? They drain the legs. They also drain the pelvis to some extent and the perineum to some extent. So I said, does she have cut, scrapes, whatever on her legs? No. He said, well, if it doesn't go away in a few days, go to the doctor. I said, but they're going to ask her, okay, if she has any sexually transmitted disease symptoms. Well, why would they ask that? Well, okay, because of where it is. So I didn't hear anything, I finally told him, I said, what happened with the lymph node? Oh, she had a spider bite on her leg and it burst in the shower and the lymph node went away. I said, what was the first thing I asked you? Okay. So this is how you track down that kind of stuff. Okay? And that's why it's important to note that as part of your physical assessment.
My brother had a swollen lymph node in the same place, and they thought it was infection, and he was on antibiotics, still didn't go away, and took a biopsy, and it's a follicular lymphoma. So.
Okay, that's the second reason. Okay. The second reason that you pay attention to lymph nodes is because sometimes cancerous cells either originate there, which would be the case with a lymphoma, or with cancer that is metastasizing. A lot of times it travels first to the lymph nodes in the area. For example, the drainage to the from the breast is to the axilla, and it's also to the mediastinal lymph nodes in here. Okay? Now, can you feel the mediastinal lymph nodes? No, the sternum's in the way. Okay? Can you feel the axillary lymph nodes? Yes, and that's part of your breast exam, yeah. Okay. All right. Now, there are lymphoid organs as well. There's not just a system of vessels. There are lymphoid organs, and we're going to be talking about each of these. You have the spleen. You have the thymus. And you have the tonsils. Now, tonsils are lymphoid tissue. They are collections of lymphoid tissue. And they're located several different areas in the body. Now, if you know that lymphoid tissue is sort of an outpost, or a fort, or a forward operating base for the immune system, if you know that, then the places that you find tonsils make total sense. You have a pair of tonsils in the pharyngeal region behind your nose. You have a pair in the mouth or behind, or just behind the oral cavity. You have a pair a little lower than that at the base of the tongue. Okay. Why does that make sense to have an outpost of the immune system there? Because that's a big place where things are coming in potentially into your body. You also have tonsil-like tissue called Peyer's patches in the intestine. Why is that a logical place to have lymphoid tissue? Again, you got stuff being absorbed across the gut. Also down here you have the appendix, and the appendix is tonsillar tissue as well. So let's first look at how these lymph vessels work, and then we'll go back and talk about the different organs. Here you have your capillaries, your capillary bed. You have your tissue spaces out here. Your capillary bed is supplying the cells that are in that tissue. We said that capillaries leak. All capillaries leak. Okay? So as the fluid comes in here under hydrostatic pressure, some of it is going to leak out into the tissue spaces. So hydrostatic pressure causes tissue to leak out. We do have another influence on where fluids go, and that is osmotic pressure. Osmotic pressure is especially active on the venous side. Large particles like albumin draw fluids in to the vascular system. That's called osmotic pressure. So you have a net movement out on this side, you have a net movement in on this side, but it's not perfect. There is some fluid that is still left over that perks around out here in the tissue spaces. Now, if that went on indefinitely, your tissue spaces would swell up like a toad, which is called edema, and eventually you'd end up having no fluid in your vascular system, because it's leaking out here, but it's not getting all picked up on this side. So, to take care of that situation, we have the lymphatic circulation. And there are little capillary-like structures called lymphatic capillaries that pick up that extra fluid from the tissue spaces. Now, these little capillaries are like little blind ends, these little lymphatic capillaries, little blind ends. When the pressure out here gets high enough, it forces fluid in through these little flap-like veins, or little flap-like openings. So when the pressure out here gets high enough, it forces fluid in through the little flaps. The little flaps are arranged so that the fluid can only go one way. So it doesn't come out of the lymphatic system under normal conditions. It only goes in. Okay? So it's picked up in the little lymphatic capillaries, okay? And then it travels on to little structures that look a lot like veins and actually have little valve structures in them. There's a little lymphatic vessel with a little valve. And the lymphatic fluid, or the lymph, that is carried in these little vessels, that lymphatic fluid is the same as what the interstitial fluid is that is surrounding your cells. Okay? So just about anything that is in the capillaries can end up in the tissue fluid, in the interstitial fluid here, except for big things. You don't see red blood cells, you don't see albumin, you don't see big stuff in it. So it's collected in larger and larger vessels. Now, eventually, that fluid is returned to the cardiovascular system. It's returned on the venous side of the cardiovascular system. And we'll show you the specifics of that in a minute. Okay? So the fluid is picked up in the tissue spaces, okay, and it's returned to the venous end of the circulatory system. Now, if you're getting fluid from the tissue spaces, anything that is invaded that tissue space, or anything that is damaged or that is wrong with that tissue space, you're going to get those products picked up in the interstitial fluid. So monitoring that interstitial fluid would be a really good thing, for the immune system to do, right? And the immune system does monitor that fluid. Okay? There are further outposts of the immune system called lymph nodes. And the fluid that is picked up from the interstitial spaces is collected, or is routed through these lymph nodes before it ends up being returned to the blood. That's nice because it cleans it up, right? There's not supposed to be bacteria, viruses, and cancerous cells circulating in the blood. When you have bacteria circulating in the blood, it's called bacteremia. When you have viruses circulating in the blood, it's called viremia. When you have cancer cells circulating in the blood, it's called a disaster. So the lymph system does a pretty good job of taking these things out. If you have stuff circulating in the blood, you usually have a really sick person. Okay. Now, any massage therapists in here? Okay, massage is good for your health. Why?
It affects every system in the body.
Okay, it affects every system in the body, but one of the most obvious things that it affects is the return of the lymph. Okay, it as you're squeezing on body tissues, okay, it forces fluid into the lymphatic system, okay, so it increases the circulation. It allows the stuff to get out of the tissues, through the lymph nodes, okay, back into the system. Okay. So it enhances your body's cleaning processes. Now, do you want to do massage on a body part that's infected?
No.
No, why not? Because remember, you don't want this stuff going through here so fast that it gets past the lymph nodes and you get, infectious stuff dumped into circulation. Okay. Okay, so your interstitial fluid is picked up, it circulates, it is gathered into lymph vessels that are very much like venules. The fluid circulates or is routed through lymph nodes on its way. Eventually, the lymph from the lower portion of the body joins a big, huge lymph trunk that runs in the back of the thoracic cavity. You have a big lymph trunk called the thoracic duct. That's this whole thing here that runs in the back of the thoracic cavity, back down close to the backbone. Now, the very first portion of your thoracic duct here is a pooched out area called the cisterna chyli. The cisterna chyli. Remember when we talked about circulation last time, we said that all of the venous flow from the intestines and the guts went where? To the liver via the hepatic portal vein, okay? And that's true. Everything that's absorbed into the veins from the intestines gets sent to the liver via the hepatic portal vein. There is one substance, though, that is not absorbed into the little venules. Triglycerides, what's the other name for triglyceride? Fats or lipids, okay, are not absorbed into the venous flow from the intestine. They are absorbed into the lymphatic flow from the intestine. Now this makes sense when you think about it. If you eat a really good, greasy pan pizza from Pizza Hut, okay, and you've got all that fat in there, okay, do you want huge globs of fat going into your circulatory system? No, because fats don't mix well with water. Okay? You would rather dilute your fats more, right? Okay. So those fats are absorbed into the lymphatic system. Then they are dumped into the cisterna chyli here. They travel with the lymph through the thoracic duct, and eventually the whole shooting match is dumped into the subclavian vein up here. Now, the subclavian vein is one of the bigger veins in the body. So whatever fats you've absorbed then have been dumped into a more dilute, a place where they're going to be more dilute in the circulatory system. Does that make sense?
Mm-hmm.
Okay. Okay, now what we're going to see when we get to the digestive system, most of the time lymphatic fluid is clear. You would expect that. I mean, if you take all the red blood cells and stuff out of plasma, it's pretty much clear. Okay. Once you get fats, though, from the digestive system in there, the fluid turns milky. And the milky fluid is called chyle. I don't know, it's a Greek thing. Okay. So the cisterna chyli is where that fat-filled lymphatic fluid is brought in from the lymph trunks, from the digestive system, travels up through the thoracic duct and into the subclavian vein. Okay. Now, that's the case for most of the body. most of the body, your legs, your abdomen, all this gets dumped into the cisterna chyli here.
And
The lymph drainage from here and from here and from up here, all that joins with the thoracic duct, and all that gets dumped into the left subclavian vein.
and then it travels through the heart.
Yep.
So that's why slowly over time, fat can build up in the
That's
arteries.
one of the theories, yeah. Okay. All right, now, but notice this part of the body is not included in the drainage system that we just discussed. Okay. The left side of the head, the left side of the thorax, the right side of the head, the right side of the thorax, and the right arm has its own duct system that is dumped into the brachiocephalic vein right here. Okay? So you have a right lymphatic duct, and then you have the thoracic duct on the other side. The thoracic duct is carrying most of the lymph drainage from the body, except for the right side of the head, the right side of the thorax, and the right arm. Now, I'm not sure why this is the case. There are some instances where it's a good idea to have lymph drainage split onto two sides. Say, for example, a person had breast cancer. Okay, you would want the lymph drainage to be split, okay, because it would make the cancer easier to control. But what the actual reason is for the arrangement like this, I don't know.
So where's the main dumping site for that one?
Okay, it's actually back behind this. Are you talking about
Yes.
thoracic duct?
No.
You're
The
talking
right
about
lymphatic
right
duct.
lymphatic duct. They kind of come in behind, okay, and the place where the subclavian vein is joined by other veins, okay, is where you have the lymphatic ducts joining as well. Okay, so in practical terms,
Did it branch off though from the cisterna?
no.
The right, no? So,
What?
no, I'm just wondering, because I know the other ones pull from the other systems on the left side to dump into the vein. And I'm curious, where does the right side start? You know what I'm saying? Like the point
Out
of
here.
Yeah, it says the picture.
Okay.
Okay, so all this is draining this way. This is draining down this way.
So this could be a stupid question, but eventually, all of this waste, so to say, it expels out, via our feces and out. I guess I just haven't put the whole picture together where this all ends up.
Okay, hang on, just hang on, because remember, this fluid is supposed to be cleaned as it goes through the lymph nodes.
Okay.
Okay. All right, now this is showing you where some of the major chains of lymph nodes are. Okay? And if you're a general surgeon, this is a really, really big deal. In fact, in grad school anatomy, for each body part, they make you learn the lymphatic drainage, in addition to the arteries and the veins and the nerves and everything else about that body part. Okay? You can't palpate the lymph nodes that are down here close to the aorta. You can't palpate the lymph nodes that are around the bronchi or that are in the mediastinum. Okay? So when you have cancerous conditions, okay, sometimes you can pick it up if you have signs in the peripheral lymph nodes. Sometimes you can't pick it up until it's very widespread. Okay, because by the time it gets to the peripheral lymph nodes, it's all on the inside in here. Okay? Notice also that these lymphatic drainage here from the axilla comes up over the ribs here. Over the ribs. Okay. Sometimes you have something called a sentinel node, okay, which is a huge big lymph node up here right above the clavicle. Okay. When you have a huge big lymph node there, you first start looking at the lymph chain from the head, okay, but you also have to look at the lymph chain coming from the axilla. Okay. So a sentinel lymph node can be associated with breast cancer sometimes. Okay. Now, a word of caution here. Okay. Every single allied health student, in their own mind, dies of Hodgkin's disease. Okay. And there's a reason for that. When you feel your own lymph nodes, they feel huge to you. Okay. So before you decide that you've got some horrible lymph node, check to make sure that somebody else can actually feel it. That's one thing. The second thing is lymph nodes that are associated with cancer tend to be painless and they tend to be rock hard. Okay. Lymph nodes that are associated with infection tend to be painful, red, hot. Now, can you have painful, red, hot nodes with cancer? Yes, but it's less likely. So here you can see where you can have lymphatic drainage from the breast. Okay, you can also have lymphatic drainage across this way because of the way some of these nodes are in the mediastinum. Okay, so breast cancer usually moves to the axilla on the same side, but it can cross the chest to the other breast this way through those lymph nodes that are in the mediastinum. Okay, everybody with me?
Mm-hmm.
Okay, looking at a lymph node. The afferent lymphatic vessels are bringing fluid into the lymph node. The efferent lymphatic vessel is taking fluid out of the lymph node. Now, remember our watermelon illustration where you have the skin on the outside and then you have the rind and then you have the meat in the middle and you have the stem on one end? Okay. The green skin on the outside would be called the capsule.
Mm-hmm.
The rind would be called the cortex. The meat in the middle is called the medulla. And the stalk is called the hilus or the hilum, depending on which book you're looking at. Okay. Lymph nodes have that same sort of arrangement. You have a capsule on the outside. Okay. You have a cortex. You have a medulla. Okay. And you have a hilus where you have your arteries and veins and where you have your efferent lymphatic vessel. Now, notice something here. How many inputs or streets coming in do you have here on this one? Streets coming in.
Four.
Oh, that one's hard.
On this one, you have 4. 1, 2, 3, 4. Okay.
Yeah.
How many streets do you have going out, Corey?
1.
1. Okay. So what happens to your traffic when you have roads that are arranged like that? It backs up. It slows down and backs up. Now, why is that a good thing? It's because this lymph node here is filled with immune system cells. It's filled with immune system cells. Macrophages, lymphocytes of various kinds, okay, T killer cells, germinal centers of B cells. We're going to go into a whole lot more detail about what T cells and B cells do in the next chapter. Macrophages, you already know macrophages are like garbage trucks. They eat everything. Okay. So you've got all this lymphatic flow coming in, you've only got one going out, so the flow has to slow down. That gives all of these cells here a crack at the fluid. Okay? Remember we said that ideally any junk coming in here gets filtered out so that the lymph that's returned to the circulatory system is clean. Okay? And you have little trabeculae and little sinuses in here where you have little communities of immune system cells.
You mean the lymph fluid? Not the lymph. You mean the lymph fluid that's returned.
Yes. Okay, now, I'm going to pick on Kelly a minute here because I think she probably knows the answer to this. Okay. What's the purpose of a forward operating base?
So that everybody has a place to go back to. Everybody has a central communications.
Central communications. Okay. And it puts your assets out there where the fight is, right? Okay. Lymph nodes work the same way. Okay. They have an intelligence function, and it puts them out there on the front lines where stuff's going to be going down first. Okay. And when we talk about the immune system in the next chapter, you'll see how that works. Okay. The lymph nodes are part of your body's early warning system. They're part of your body's, your immune system's intelligence gathering apparatus. And it makes sense because they're getting all the information coming in from the fields here. Okay, now, the thymus gland. The thymus gland gets very short shrift when you were talking about the lymphatic system. And the reason is we don't know very much about the thymus gland. We know that the thymus gland is located underneath the sternum in babies and children. We know that the thymus gland produces a hormone called thymosin, and we know that that hormone has something to do with development.
Oh.
Yeah.
That looked like a table was coming.
Yeah.
Well, it should be.
I'll tell you what, let's take a break because it's 10 till. Gotta give everybody.